Environmental influences that affect the development of an infant. Environmental influences play a critical role in shaping an infant's development across physical, cognitive, emotional, and social domains. These influences can be broadly categorized into prenatal, at birth and postnatal environments. Here's a breakdown of the key environmental factors affecting infant development. Number 1. Prenatal environmental influences. These are factors that affect the infant while still in the womb. 1. Maternal health and nutrition. Poor nutrition or lack of essential vitamins, like folic acid, can impair fetal brain and organ development. The mother is the only sole source of nutrition for the unborn child. A diet providing the proper balance of proteins, fats, carbohydrates, minerals, and vitamins is vital. Many correlational studies of humans indicate a relationship between maternal diet deficiencies and prematurity, low birth weight, stillbirth, growth retardation, and poor mental functioning. 2. Exposure to toxins, drugs, and chemicals. Smoking, alcohol, drugs, and environmental pollutants, like lead or pesticides, can lead to developmental delays, low birth weight, and congenital anomalies. For a healthy delivery, it is necessary to avoid any kind of drugs and chemicals unless they are professionally recommended by the doctors. Alcohol, antihistamines, aspirin, excess doses, barbiturates, heroin, lead, quinine, thalidomide, insulin, large doses, used in shock therapy, and tobacco are the drugs and chemicals which affect the possible prenatal period development. In many cases, the drugs cause stunting or complete absence of the arms, legs, and fingers. Abnormalities of the internal organs may also occur. Abel, 1980, and Steckler and Halton, 1982, found in their research that greater consumption of alcohol is known to harm the developing embryo and fetus. Having an occasional drink may not be harmful to the mother or fetus. During pregnancy time, more than 3 times consumption of drinks per day would lead to children showing permanent growth retardation, brain cell abnormalities, eye, ear, and other facial disfigurations, joint and limb abnormalities, heart defects, mental retardation, and attention deficits. Even smaller daily consumption of alcohol by pregnant women may result in poor attention and reaction time in their children at preschool age. It has been noted that cigarette smoking had a high risk of delivering prematurely. It is associated with prematurity and low birth weight. These children may suffer from later growth and cognitive deficiencies. A pregnant woman should guard against exposure to all drugs and chemicals during pregnancy, but she must be particularly careful about taking drugs. 3. Maternal stress and mental health conditions. High stress levels or untreated mental health conditions, like anxiety or depression, can affect the baby's stress response system and brain development. 4. Infections during pregnancy. Infections like rubella, Zika virus, or toxoplasmosis can lead to serious developmental disorders or birth defects. 5. Abortions. 6. Age of mother. The maternal age have a higher risk for infant defect, prematurity, and infant death. 7. Rh incompatibility. A genetic pregnancy complication that occurs when a mother's Rh-negative blood is incompatible with her baby's Rh-positive blood. The mother's immune system produces antibodies that attack and destroy the baby's red blood cells, which can lead to anemia, jaundice, and dangerous swelling. The severity of the effects depends on how many red blood cells are destroyed. 8. Radiation. Radiation is responsible for causing damage to the fetus. Larger doses of therapeutic radiation may be injurious to the fetus and sometimes cause spontaneous abortion. 9. Access to prenatal care. Early and consistent medical care helps detect and manage potential problems. Number 2. During birth, environmental influences. 1. Physical hazards. A. Complications at the time of birth. B. Multiple births. C. Post-maturity. D. Prematurity. Number 3. Postnatal environmental influences. Number A. Physical environment. 1. Safety and cleanliness. Safe, clean, and stable housing supports healthy growth and minimizes exposure to accidents or illness. 2. Pollution and toxins, air and water pollution, exposure to mold or heavy metals, like lead in old paint, can impair cognitive and physical development. 3. Nutrition, adequate nutrition, breastfeeding or formula feeding, introduction of solid foods, is essential for brain development and immunity. Number B. Social and emotional environment. 1. Parent-infant bonding, secure attachment fosters emotional regulation, trust, and social skills. 2. Responsive caregiving, caregivers who are responsive to cues, e.g., hunger, discomfort, distress, help the infant feel safe and understood. 3. Stimulation and interaction, talking, singing, and playing help with language development, motor skills, and cognitive growth. 4. Parental education and involvement, parents who are informed about child development can better support and respond to their child's needs. 5. Traditional beliefs. 6. Helplessness. 7. Attitude of parents. 8. Abuse. Number C. Economic factors. 1. Family income. Low socioeconomic status can limit access to nutritious food, healthcare, and safe environments. It may also increase stress levels in the home. 2. Access to healthcare. Regular health checkups, vaccinations, and early intervention for delays or disabilities are essential for optimal development. 3. Childcare and early learning. Quality childcare and early stimulation programs support social and cognitive development. Number D. Cultural and societal context. 1. Cultural beliefs and practices, feeding practices, sleep routines, and socialization norms differ by culture and influence development. 2. Gender norms and expectations, these can shape opportunities for exploration and learning. 3. Media exposure, screen time and type of content can affect attention, language, and behavior patterns. Conclusion. Environmental influences on infant development are multi-layered and interact with each other. A nurturing, responsive, and stimulating environment both before and after birth is vital for healthy development. Early identification of adverse influences and timely support or intervention can greatly improve developmental outcomes.